Hello, my name is Dr. Shawn Wen. I'm an internal medicine resident mentored by transplant hepatologist Dr. AnnMarie Liapakis at NYU. In the next few minutes, I'll be discussing what the donor evaluation process looks like for living donor liver transplant. First, to set some context, let's talk about what living donor liver transplant is. Living donor liver transplant is when a healthy person, called a living donor, gives a portion of his or her liver to someone in need of transplant, the recipient. Unfortunately, the number of people who need a transplant is much higher than the number of organs available from deceased donors, so liver donation, in short, saves lives. Donors can enter the evaluation process with a specific person like a relative or a friend in mind. This is called directed donation. Alternatively, donors can opt to donate to anyone in need on the wait list, which is called non-directed donation. So now let's focus on the evaluation itself. The key takeaway is that coming forward as a potential living donor is completely voluntary, and the donor's safety is the number one priority. And because of the focus on safety, the evaluation process is rigorous. It involves extensive education about the risks and benefits of donation so that the donors have all the information they need to give informed consent. Donors have the right to withdraw from evaluation at any point for any reason. Potential donors undergo blood work for blood type, cell counts, kidney and liver function, and HIV and hepatitis screening. They get liver imaging to assist in surgical planning. They get a chest x-ray to exclude lung disease. They get a heart workup, including an electrocardiogram looking at heart rhythm, an echocardiogram looking at pumping function, and if needed, a stress test. Results of age-appropriate cancer screening are also reviewed. In addition to assessment of physical health, a psychosocial evaluation is done to ensure mental well-being and adequate social support. And finally, functional status is assessed, since being in good condition before surgery is important for how donors do in recovery. Importantly, donors do not pay for this evaluation. There are resources to help offset other costs, like lost wages, with the goal of making donation financially neutral. The donor evaluation team includes an independent living donor advocate, a nurse coordinator, a liver surgeon, a liver specialist called a hepatologist, social worker, mental health provider, and registered dietitian. After the testing is complete, the team carefully reviews each case and decides whether it would be safe to proceed with donation. In summary, liver donation is an amazing life-saving gift. As discussed, there is an intentionally rigorous evaluation process by a multidisciplinary team to ensure the physical and mental well-being and safety of the altruistic individuals that come forward as donors. Thank you so much for listening, and I hope you've learned something.